Good morning. Now we are going to discuss their use, side effect of those diuretics we have discussed, that is the weak diuretics. Now coming to the carbonic anhydrase inhibitors, they are used into the treatment of the open angle glaucoma. Right? So they are, in case of the glaucoma, again you can say that there is a deposition of the water into the eyes. So you can say that the pressure is more in the optic nerve, so that is used into the glaucoma. Edema due to the congestive heart failure or drug induced edema. So in case of the congestive heart failure or the drug induced edema, it can be used. Next is petit mal, localized seizure, it can be used, but there you can say that activity is limited, less limited. Next is mountain sickness. In case of the mountain sickness also, this carbonic anhydrase inhibitor can be used. So this is, you can say that indication and side effect. Now if we are using these drugs for a long time, then you can say that may commonly compromised by the development of the metabolic acidosis. Then we need to discontinue the treatment. Electrolyte imbalance, particularly tingling failing into the extremis, it can be happening. Hearing dysfunction, or that is the tinnitus, again it can be there. Loss of appetite, taste alteration, gastrointestinal absorption disturbance like nausea, vomiting, diarrhea. These are the some usual side effect of this carbonic anhydrase inhibitor. Other than the polyuria, frequent urination also it can be there. Now occasional distance of drowsiness and instance of the drowsiness and confusion, that also we can observe in case of the carbonic anhydrase inhibitor sometimes, less sometimes. Next is potassium sparing diuretic. Now in case of the potassium sparing diuretics, you can say that it is, you can say that potassium sparing diuretics exert mild diuretic effect, because 2 to 5% only sodium is excreted through that particular process, because of the collecting that is only 2 to 5% of the filtered sodium. Now they can act potential, they can also potentiate the effect of loop diuretic. So if we are giving along with the loop diuretic, they can, you can say that increase the effect of the loop diuretics. Now you can say that hyperaldosteronism, hypokalemia, for correction of the excessive potassium loss. They are the little benefit with the patient with the diastolic syndrome and drug resistance hypertension. So in such cases, this drug it can be used, but again they are having the very less activity, less means potent activity on the diuretic. That's why you can say that hypertension and all, you can say that majorly loop diuretics as a diuretics are generally used. Now in case of the side effect, now you can say that enlargement of the glandular tissue in the male breast, that is the gynecomastia, it may be occurred. Now this particular effect due to the estrogen steroid receptor, due to the estrogen steroid receptor, and because they have the selectivity to the mineralocorticoid receptor, it may be there. So this is, you can say that, side effect. Now in case of the osmotic diuretics, now osmotic diuretics generally reduce the intracranial pressure in the neurological condition, reduce intraocular pressure before the eye surgery. Before the eye surgery, it may be observed. Now it is, you can, we know that it is acted by the osmosis, so it is poorly absorbed from the GIT tract when we are giving the orally and causing the osmotic diarrhea. It must be given parenterally for systemic effect. Now it is excreted by the glomerular filtration with 30 to 60 minutes without any important reabsorption, secretion or the metabolism. Now side effect, extracellular volume expansion. Mannitol is distributed into the extracellular place and the extract water from cell, leading to the expansion of the extracellular volume. Hypernatremia before the mannitol produce the diuresis. So this can be there. This can be complicated into the heart failure or the pulmonary edema cases, that can be problem. Headache, nausea, vomiting we can observe commonly. Dehydration, hyperkalemia and hypernatremia also we can see. So these are the some of the reference. You can go through this reference and we can again discuss this one if you have any problem.